Hi. Well, we'll try this again with recording it in a different approach. We're using this webcam to give an introduction, and then I'm going to switch on over to the PowerPoint presentation. So my name is Robin Cooper, and I'll be presenting some recent research that's been done on the effects of muscle injury and some therapies. Let's switch on over to the PowerPoint slides and then see how this goes. Because of this approach, you'll be able to see everything that I show on the PowerPoint slide. So you won't have to follow the video along with the PowerPoint. It's all going to be combined as one. Okay, so here we go. And now we see the PowerPoint slides. This is a presentation on the recent journal articles and related topics on the effects of deep tissue injury, muscle, and the healing processes. What we can see is that pressure injuries against bone, for example, can cause a deep tissue injury, such as this protuberance on the bony processes can then push on the muscle when some external force is applied to the body. So this type of injury can cause an injury from the external, but also internal due to the muscle hitting on the bone. You can have other types of muscle injury, such as this pull tear injury, such as when you exercise, you would potentially stress out the muscle and tear it, damage the muscle. So this is another type of injury. And in time, these types of injuries can lead to an open wound, and that can then lead to infection and a bigger problem for someone to treat and heal. So you can have these inside outward or an outside inward types of tissue injury. These possible deep tissue injury, it's more than just what you see on the surface. As you see in this picture here, the surface you can see might show a small bruise, but underneath there's a wider array of injury. This can be more like a tip of the iceberg type of problem, and you can't see what's underneath. So the suspected deep tissue injury needs to be examined, and if it's not taken care of, it can quickly develop into the stage 3 or stage 4 pressure ulcers, where the skin is then broken. The causes of this deep tissue injury development are multifold. It's a complex series of events, such as we just talked about, the bone and muscle interface, the deformation, pressure of the muscle on the bone, ischemia, the lack of blood flow to a particular area. Ischemia reperfusion injury can also occur when you increase the blood flow back to the tissue. That can actually further the injury even more, and this is also a problem in the central nervous system. Impaired lymph drainage, when the interstitial fluid cannot drain out through the lymph appropriately, that can build up back pressure and swelling in that tissue. So this alteration in the interstitial fluid is very important, and that can lead to more swelling, for example. And where does this interstitial fluid, more of it can be present due to the capillary wall being permeable, and then fluid coming out of the blood, and you end up with what's called edema. This could also end up in compartmentalization, where the pressure is so large that could further impede blood flow and enhance more injury. Inflammatory changes can also take place, cause apoptosis, is the cell-regulated cell death that could be triggered, and that's a problem as well. So how to prevent further muscle or tissue damage as a result of the primary injury? That's really of the main point. One is you don't want the injury to then have skin breakdown any more than already happened from the primary insult. Increasing blood flow seems to be an important factor. In some cases, heat might be useful, or even cold, to keep down the swelling. Medications are utilized as well. Non-steroidal anti-inflammatory drugs, NSAIDs, to block prostaglandins and further problems. Steroids such as glucocorticoids can be used to reduce the swelling. But the current recommendations that are followed for a suspected tissue injury, such as the ones we've been talking about, are basically to treat them like pressure ulcers. And that includes repositioning schedules, reposition a patient that's in bed, for example, so they're not sitting on a bony prominence too long, support surfaces, cushions, air mattresses, for example, and keep the skin intact, and provide good nutritional support for healing processes. At this time, there seems to be no new treatments identified for deep tissue injury. So this is where this study is important. That just came out. It's published in the International Wound Journal Injury. This is a pre-article. The PDF is up online as well, there that you can download. So this is Jeremy Honaker and Michael Forston and the rest of the co-authors here. They work at Central Baptist Hospital in Lexington, Kentucky. Jeremy Honaker is a wound specialist nurse, and Michael Forston is a physical therapist that specializes in physical therapy of wounds. So it's quite interesting. And they put out this article and looking at the effects of ultra-frequency ultrasound on the healing of the suspected deep tissue injury. It's a retrospective analysis because they went back and looked at patient data files and then pulled the information together. Basically, what they wanted to look at is to determine if ultrasound therapy would be beneficial or harmful. What they found is that, the way this ultrasound therapy works is it delivers this ultrasound at a low intensity and a low frequency, about 40 kilohertz. It's not in contact with the skin, so it's a non-contact low-frequency ultrasound, abbreviated as NLFU. And it's a mist. It's a saline mist. I'll show you a picture here in a minute. It's a non-thermal effects of healing, so it's not the kind of ultrasound that can increase the heat in the tissue. This low-frequency ultrasound waves can penetrate deep into the tissue compared to, say, longer ultrasound or longer wavelengths. Here's the way this instrument looks. It has a saline bottle up at the top, as you can see up here, and then this makes the ultrasound, and that ultrasound then travels through the saline mist onto the patient. And here you see the ultrasound wave and the saline mist. What it does is it penetrates into this tissue, and the company actually comments that this ultrasound waves can break up bacteria. I haven't seen the primary literature to support that, but that's what the company states. For this study, they looked at three main characteristics of the deep tissue injury. They used to identify severity. They used a tissue surface area and skin integrity and a wound color assessment. And this is a scale that Honaker developed here. It's a total surface area, and they score it based on the area, plus the skin integrity. Is it intact or is it broken? And then the coloration of the tissue. And these are indices that then are added together to give you an overall score. So the take-home points of their study is they looked at two different groups, one that received the therapy and one that did not. And the one that did receive the therapy improved by 2.52 on this 3.3 to 18 scale. So what they found basically was that this therapy of this non-contact low-frequency ultrasound probably had a beneficial effect in the progression of this deep tissue injury because their assessment scale showed an improvement. And this is one of the first articles I'm aware of that actually documented the treatment of this ultrasound therapy. So it's an important article in the sense of documenting this kind of treatment and what kind of wounds would actually heal from it. Well, as biologists, we're interested in what are the mechanisms behind this as well, and understanding the mechanisms might actually result in new therapies. The idea is that this ultrasound frequency has been shown to upregulate a number of factors, and particularly this endothelial nitric oxide synthase, NOS. And even with shear stress, this can actually increase NOS as well. And in microstreaming, where the muscle is moving, and this kind of ultrasound therapy causes the energy waves to go through a few cells. Basically, this NOS improves blood flow, can decrease the muscular reperfusion edema that occurs. It decreases this inflammatory response by decreasing leukocytes going out of the blood into the tissue. It can decrease nitrogen and oxygen delivery So there's decrease in radical formation. Upregulation in vascular endothelial growth factor, and a decrease in release of TNF and interleukins. So basically decreasing the cytokines that would be activated. So these seem to be some of the mechanisms behind the ultrasound therapy. At least these is correlative. And so what's available in the literature does suggest that low-frequency ultrasound is capable of stimulating cellular activity through this mechanical energy. And it's in the absence of adding extra factors to the injured tissue. But I feel some experimental studies in animals are warranted to measure and to really follow through with this. I mean, it would be interesting to see what measuring blood flow with Doppler techniques, for example, and in a healthy tissue, and then give the ultrasound and see how that's working. Maybe even look at glucose uptake metabolism, for example, in healthy tissue, and with the ultrasound and without the ultrasound, and see if that makes a difference. Something I would think it would be quite interesting is seeing if tissue perfusion with saline. If you have a large muscle injury, those cells are breaking down and spilling out proteins and also potassium, the ions inside of the cell. Well, those high protein levels can actually get in the interstitium and the lymph, back in the circulatory system, and then they can actually cause acute renal failure. They can block the glomerulus from filtration, and this could be quite a big problem. Also, it upsets the whole osmotic balance if you have such a high protein level in the blood. In addition, the ions that spill out of damaged tissue, such as potassium, I think that could be a key factor in causing the spread of this deep tissue injury, because high potassium can actually depolarize neighboring cells and then cause those to lose their membrane permeability and then become injured themselves. One could test high potassium injections, say in mice, and see if you see muscle injury. Relate that to the potassium concentrations that one might measure from a massive muscle injury, and see if they're correlative, and see if this has a factor or not. The idea of potassium, in high potassium around cells, is nothing new to causing them to die or to be damaged. In the 1930s, T.P. Feng noted that high potassium due to, say, crushed muscle, if you put the fluid from the crushed muscle onto normal cells, it can cause them to be damaged too. So it's not anything that far-fetched. So any kind of ringer that has a higher potassium, about 10 times that of normal, can already cause cell damage. So I think getting rid of the potassium in a large muscle damage might be very beneficial. Maybe this could occur with perfusion. Okay, so that might be something that could be looked at and would be of interest. This rest of the PowerPoint is on some other articles, which I don't have time to go over right now, but it's actually research studies that were done in pigs to try to quantify some of these deep tissue injuries. Okay, thank you. And let me go back to the slide. Hopefully you've seen some of the ways that you could put different PowerPoints together with your webcam and have some fun trying this out. But we do want to see that you use some primary articles. You can copy pictures out of primary articles and put them into your PowerPoint. Just cite them where you're getting them from. And then we want to make sure it's at a level of high, academic interest in trying to get to some of the mechanisms as well of what you're talking about.